They're
Cute.
harmless little
They're
fellows.
so cute.
Yeah. Experts are seeing more head and neck cancers in younger people, even in their 20s.
And this year alone, the American Cancer Society estimates more than 50,000 new cases will be diagnosed and more than 12,000 losing their lives from this terrible disease.
Tonight, Fox 9's Leah Bino introduces us to a woman who has survived cancer 3 times, and she's not even 40 yet.
Routine scans every 6 months to make sure her tongue cancer hasn't returned are something Brooke Vitens never misses.
Flap looks wonderful.
10 years ago, when she was just 26 years old, a dentist checkup changed her life.
My dentist noticed some white spots under my tongue. He wasn't super concerned, just because I was young, not a smoker, anything like that, but decided we should biopsy it just to be safe.
Those spots turned out to be cancer, requiring part of the left side of her tongue to be removed 3 times over the past decade. Eventually, reconstruction was required using skin and veins from her forearm.
I was on a feeding tube for about a month, and then just really relearning how to eat and swallow and speak with having a full tongue in my mouth again for the first time in like 8 years. It was super scary.
Unfortunately, Brooke's case is not rare anymore.
Dr. Deepak Kadamani started his career as a dentist before becoming an oral surgeon. He points out, unlike in Brooke's case, head and neck cancers are diagnosed in late stages, 50% of the time, which directly impacts the complexity of treatment and survival.
These cancers often are very insidious. They tend to grow slowly, so patients don't tend to appreciate symptoms as frequently, and they're often overlooked as well by either their actual dentist or their primary care physician.
In fact, one of Kadamani's close friends and fellow physicians suddenly became one of his patients when a pain under his jawline could no longer be ignored, but he fell behind on getting scans to check on the potential problem.
And that's the area that we are concerned about.
And then COVID hit, and as a lung surgeon, I was really busy during COVID, and that kind of backburnered the way I was feeling. And then as all that dust settled, I started to really realize, wow, there's a more noticeable bump there now, and it hurts.
His cancer also requiring surgery. These and many more patients are part of the reason Dr. Kadamani started the Head and Neck Foundation, which will soon start offering some free screenings for suspected cancers. Although the American Cancer Society points out there is no screening tests that are able to find oral head and neck cancers early, still regular checkups and visits to the dentist are recommended for overall health, where the throat, mouth, and nose are looked at during these visits. If cancer is suspected, other tests will be needed by a specialist.
Unlike other areas of the body, for example, breast cancer, where we have not only a physical examination, but we have a screening test such as mammography, in the head and neck, we don't have a screening test that's approved for screening of the general actual population in asymptomatic individuals. What we tend to rely on is a really good physical examination and making sure that's done, and any actual biopsies if there's any lesions that are suspicious.
Reasons why these type of cancers are increasing used to mostly be blamed on smoking, but now reasons why vary more.
We are definitely seeing the actual incidence of these cancers rise, not only here in America, but also worldwide. We don't completely understand the reason for it. We think that some of it is because of HPV, but there's probably other factors, if they're environmental or things like that, that we don't completely appreciate. But 30 years ago, we would never see patients in their 20s, 30s, and 40s developing these types of cancers, and now we see them pretty routinely.
Dr. Kadamani's advice is if any problem persists for 14 days, see a doctor. Brooke is beyond thankful she did.
You know, it's just super important to be aware of things happening in your body and checking it out, even if something doesn't quite feel right.
Leah Bino, Fox 9.